I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, and today we're actually going to be demonstrating Laviv injection. So Laviv is actually human cultured fibroblasts. So about 3 months ago, our patient had a small skin biopsy taken from behind her ear, and that was sent to a lab. And from that skin sample, her fibroblasts, which are the collagen-producing cells in her body, were actually cultured. And so now we have 2 syringes about this size, just teeming with millions of fibroblasts. And so we inject this very superficially into the skin. I think Laviv is helpful at sort of stimulating collagen growth, but it's most helpful, I think, in sort of fine lines. It gives a little bit of volume correction, but not as good as I think some of the textural changes that you can see over the skin. So we're going to actually inject the on-label, her nasolabial folds, but she has a little bit of just superficial atrophic acne scarring on her cheeks. So we're also going to inject those as well. So with that, we're going to get started on the right side. And so we'll come in a little bit closer so we can take a look at the nasolabial fold. So I'm going to do a little poke. She's had some numbing on, so this should be pretty comfy. And when we do this, it's going to be a really superficial injection. So you actually should see blebbing. So you see that little just light blanch, and that means that we're actually in the dermis, that second layer of the skin. And so we end up laying about 0.1 cc's in each of these areas. So we're going to start with that one. Is our patient hanging in there? Mm-hmm. Good. And then here comes injection 2. She's doing perfect, and that's just what I want to see is this blanching. That means we're in the right plane for injecting these human fibroblasts. We use a really small needle. It's a 30 gauge, so it's comfortable for the patient. I'm really big on patient comfort in general, so we're going to just march down this way, starting on our third one. And with each of these, we're putting an aliquot of about 1/10 of a cc. We get about a cc on either side. So the majority of this I'm going to put on her nasolabial fold. And then we'll reserve a little bit for her acne scarring on the cheeks. Doing great. Mm-hmm. Pretty comfortable? Mm-hmm. It's a very tiny needle that we use. This is similar to what a diabetic that gets insulin injections would get. So very, very small needle, shouldn't be uncomfortable. But just a touch above here. Almost done with the nasolabial fold. And now with the 3/10 that we still have left over, I'm going to go after some of the atrophic acne scarring that's on the cheek. So little teeny blebs, okay? I think the idea with this is you just sort of coat the area where there's a little bit of acne scarring. Tilt your chin out for me. Good. Perfect. So that completes Laviv injection on the nasolabial fold and for acne scarring.